Hello everyone, my name is Wu, and welcome to my capstone presentation, Traumatic Experiences in Healthcare Settings. First, I would like to express my gratitude and extend thank yous to my degree mentors, Dr. Brenda Hussey-Gardner and Dr. Michelle Stars-Gaiano, my INDS advisor, Professor Stephen McAlpin, and the entire INDS staff and faculty, Dr. Stephen Freeland, Professor Carrie Sauter, Professor Eric Brown, and Professor Holly Cutzillo. Thank you for all the support and encouragement from the start of my INDS journey to the completion of my capstone project. So I'm just going to turn off my camera now that I did the little intro. So I would like you to raise your hand if you were afraid of shots as a child. For those of you who raised your hand, just know that this is very common. For myself, I was also really scared of shots. Immunizations are actually considered to be one of the most painful medical procedures for children, causing over 90% of young children to exhibit severe distress during immunizations. And I also want to mention that throughout this presentation, I'm going to be using the words shots, vaccines, vaccinations, and immunizations interchangeably. So for this project, I was really interested in researching healthcare-induced anxiety and trauma. However, there are so many different healthcare settings and procedures. So there's like preventative clinic visits, acute care, hospitalizations, vaccinations, and surgeries, and those are just a few to list. So I focused specifically on vaccination and immunization anxiety. Not only is the delivery of vaccines and immunizations one of the first traumatic experiences for a child in a healthcare setting, but from birth to 6 years of age, if they follow the recommended immunization schedule released by the CDC, a child can receive over 20 shots, and that's not even including the yearly flu vaccines. So this leads to my research question of what is healthcare-induced anxiety and trauma, specifically regarding vaccination and immunizations, and what can pediatricians do to reduce pediatric patient anxiety? So in order to complete my project, I really wanted to focus on two professional fields and draw knowledge and research from the field of clinical psychology and pediatric medicine. These disciplinary perspectives allowed me to conduct a literature review and provided information and answered some of these questions, such as what is healthcare-induced anxiety, what are the roles and responsibilities of a pediatrician, and, and also identify existing clinical strategies and interventions for pediatric patients. So, along with the literature review, I conducted a mock qualitative study and also presented to peers on campus. The purpose of the mock qualitative study allowed me to conduct semi-structured interviews. I conducted one with a pediatrician and one with a parent, and this really allowed me to learn about real-life experiences and hear those personal anecdotes that can often be missing in research and literature. And also the information from the interview, I was able to analyze against the information I found in literature. So the cross analysis, I was able to identify common themes or contrasting viewpoints. And then through the member check, I was able to confirm with the pediatrician and the parent to see if they agreed with the findings. And then I was also able to present to the Pre-Med Society at UMBC to raise awareness about vaccination and immunization anxiety among students who are also interested in the field of medicine. So I just also wanted to highlight two key researchers, Dr. Lurwick and Dr. Cohen. Dr. Julie Lurwick is a mental health practitioner, and she really explains why it's so important to reduce anxiety and prevent trauma in pediatric patients. She stated in her work how unidentified and dismissed anxiety behaviors of children not only can they delay important medical treatment, make treatment take more time to complete and reduce patient satisfaction, but it can also further perpetuate that trauma. And this untreated trauma also impacts the child mental health, but it also predisposes children to various forms of psychopathology and that includes anxiety, depression, and behavioral problems. And it's even more complicated when these things also increase the cost of care in the future for the children. And not only does she make the argument that it's important to reduce anxiety and prevent trauma, but she also places the responsibility on healthcare professionals to do so. Um, Work from Dr. Lindsay Cohen states that when children are in a powerless environment, such as receiving vaccinations, the behavior they demonstrate may be anxiety behaviors or pain behaviors. Often, pain and anxiety are correlated, but they're not the same. So, this places responsibility on healthcare providers to be able to differentiate between pain and anxiety in order to implement strategies accordingly, whether it's a strategy to decrease the anxiety or decrease pain for the patient. However, Dr. Cohen's study conducted with the team of clinical psychologists and pediatric medical researchers, the results were a little concerning to find that discriminating between pain and anxiety behaviors may not be a priority for a healthcare professional who is focused on administering the shot. So some of the outcomes from the literature review and interviews was that I learned about the care process, which was proposed by Dr. Lerwick, and the care process was is to prevent healthcare-induced trauma and reduce anxiety. The care protocol was developed to foster trust in medical care providers and mitigate the risk of anxiety and trauma. So, CARE is an acronym for Choices, Agenda, Resilience, and Emotions. Choices is providing power in a powerless environment. Agenda is letting the patient and family know what to expect and what is expected of them. Resilience is starting with the strengths and reframing negatives. And emotions is recognizing and normalizing common fears and responses. So, what I found really interesting when I was conducting the interviews was um, with my interview with the pediatrician, I learned that the most important principles of the care process was already being practiced. Um, and it just didn't have like a formal name, and the practitioner just wasn't familiar with what was known as the care process. But those key principles of choices, agenda, resilience, and emotions, they were being used in practice. And in order to make sure that the child feels comfortable in unfamiliar surroundings, it's the medical provider's responsibility to observe and recognize behaviors of fear, anxiety, and trauma. So, in my interview with the pediatrician, we were talking about how, for example, you're able to give a child power by allowing them to choose if they would like to receive the shot in the arm or the left arm, the right arm, or maybe even a leg. And then I was also able to learn that not all children are afraid of vaccines, and there are some who truly do embrace them. And the pediatrician shared how a lot of those children who do embrace vaccines, it typically happens at the age when they develop the cognitive skills to understand the importance of receiving vaccines. And then for those children who truly struggle with vaccinations and demonstrate atypical responses, the pediatrician will utilize other resources to make sure that there aren't any other underlying reasons for those anxiety and fear behaviors. And the major theme that I saw from literature and my interviews were that in order to make sure that any strategy that is implemented, it needs to be age appropriate and development appropriate, and also respond to the specific behaviors that the child presents. So, for example, a child who is stoic, the pediatrician might recommend that you give them a distraction. And then for a child who is more avoidant and may demonstrate escape behaviors, the pediatrician might recommend that the parent hold the child like as if they're giving them a hug to brace them down rather than having more unfamiliar medical professionals enter the room to hold them down for the vaccination. So for my project, I utilized the bridging strategy of bridging the explanation action gap. I use knowledge from clinical psychology to define the nature of the problem of what is healthcare-induced anxiety, while understanding that there are so many factors that impact and contribute to anxiety in pediatric patients, such as treatment delivery and healthcare settings, and also understanding that anxiety is demonstrated very differently in each child. And then I was able to identify solutions and interventions once I understood what was expected from a pediatrician and healthcare professionals who deliver the shots to pediatric patients. And then I was able to identify existing clinical strategies that were either suggested by clinical psychologists for pediatricians to use in practice, or those strategies that were already used in practice by the pediatricians. For my project, there were a few limitations. Since I conducted a mock qualitative research study, the interviews weren't considered as data gathering, so any of my findings and information from my cross-analysis are not statistically significant or considered to be conclusions. Another limitation is that it's a common occurrence for nurses and medical assistants to be the one administering vaccinations rather than the pediatrician. So for future directions of my project, I would like to interview other healthcare professionals such as nurses and medical assistants, those who are the ones who are administering vaccinations regularly. And I would also like to interview more parents, not only to hear about a variety of experiences and diverse perspectives with children of different ages and different reactions to vaccines, but also gain insight on what the parent role is in impacting their child's vaccination experience and also the anxiety that they may have. And I would also like to interview adults or older children who can recall their own experiences with vaccinations. And that is it for my presentation.
Thank you, Wu. Well done. Let's go straight over to questions then. Anything from anyone? Wu, I'm going to break awkward silence before I force them and just say out of sheer curiosity, can you tell me a word about presenting to the pre-meds? I'm fascinated by the institution at UMBC of pre-med culture and how different your project was from where they tend to emphasize. Did you find them receptive? Were they surprised? Anything you want to tell us?
So in order to present to the Pre-Med Society, I had to do a voice thread. So I wasn't able to give a live presentation and like actually get reactions or questions. I pre-recorded a voice thread and it was shared in the newsletter. And in my reflection portion of the project, I kind of talked about how I wasn't really sure if I even had any viewers from it because it was an online pre-recorded presentation, so I'm
That's
not
fine.
sure.
Thank you. Good answer. And to be honest, what I'd missed, and it's coming in, you have many people watching you right now who are asking questions. So maybe I should read some of them out, although please feel free to read your own. Davis, I think technically you got your hand up first, if that's okay. And then Dr. Hussey Gardner.
Yeah, I actually kind of had a question. You had mentioned that a lot of times it's not the pediatricians that are giving the shots, it's other healthcare professionals. So I was curious as to why you focused more on the pediatricians than the other healthcare professionals.
So when it comes to pediatric care, it's kind of characterized through it being a team of the pediatrician, the parent, and the child, like a triad. So I really wanted to keep the focus on that. And also, although pediatricians aren't the ones administering the shots often, they still have a lot of power and responsibility to reduce the anxiety leading up to the vaccination or the time that the child would receive it. So, for example, during my interview with pediatrician, she was saying how if she knows that she's seeing a child who is scared of vaccinations, the first thing she does when she walks into the room is announce if the child is getting the vaccine, getting a shot that day, or if they're not. And if they are getting the shot, then she likes to depending on how they react to it, she'll walk them through like what shots are you getting, how many are you getting, what's the purpose of them. So although the pediatrician isn't administering the shot, that time period that she is seeing the child before they get the shot, oftentimes they have the power to reduce the anxiety as well.
Thank you. And Dr. Hussey Gardner, who is an associate professor of pediatric medicine at UMD, would you like to vocalize your own question?
Yes. So, Wu, I was wondering, it's a two-part question. One, what is the most important thing you feel that you learned from this project? And then hindsight is always so informative. If you were to do this project over again, what would you do differently, if anything?
I think the most important thing that I learned was how to be a qualitative researcher. When I was conducting the interviews, the questions kind of, I believe, framed I was looking for specific answers. So the questions were like, what would you do if a child, like for a parent, for example, I would ask like, oh, like, how is your child afraid of shots? Instead of being like more neutral, like, oh, like, what are your child's reactions to shots? So that was like one of the things that I learned. And if I were to do the project over again, I think I would really want to include the perspective of other healthcare professionals, just to get the sense of a whole healthcare team rather than just a pediatrician.
Thank you. And we've a couple minutes left, so I'm going to dovetail two of them here who asked you. Actually, let's go to Stasiano first, if I may. Dr. Stasiano, you asked what was the biggest difference you found, Wu, between what you'd read and what you experienced, particularly in the interviews?
I think the biggest difference was obviously literature, because I was more focused on looking at vaccination anxiety and immunization. It didn't really highlight the percentage or the children who weren't afraid of vaccinations. And when I was speaking to the pediatrician, one of the most important things that she wanted to make a point of is that not all kids are scared of vaccines, and if they are, it's definitely more age appropriate and development appropriate, and it is something that a lot of kids do grow out of. But if they don't and it's more atypical, that there are so many resources, like the pediatrician, they can bridge a connection to other professionals who would help the child go through their underlying anxiety and trauma that might not be related to the vaccines. So yeah.
Thank you. And with just 60 seconds remaining, to folk asked, what was the age range of the children that you were considering?
I didn't have a specific age range. I was looking more towards elementary to preschool age children, preschool to elementary, but that's what it was when I was looking at literature. However, with speaking to the pediatrician, she saw anyone from birth to 21. So
Gotcha.
yeah.
Thank you very much. And look, you answered. Oh, actually, no, we should. There are plenty more questions. I think, Carrie, if you don't mind putting Wu's email contact in chat for anyone who would like to pursue, I know that we would enjoy answering further questions.